My research has been focused on alcohol harm minimisation in the Northern Territory, and I feel extremely humbled to be the recipient of this award. There's been many that have worked on various projects, a program of work around alcohol harm minimisation in the Northern Territory. We know that it costs $1.38 billion per year, and we know that that is felt among those that are most vulnerable, our Aboriginal Torres Strait Islander communities, our rural and remote communities in the Northern Territory. So the alcohol harm minimisation work that we've been doing integrates with a number of other research programs that we have up here, those relating to mental health, social and emotional wellbeing, those relating to Aboriginal and Torres Strait Islander health and wellbeing, and those relating to men's health and wellbeing. Alcohol research that we've been doing is being used by a whole range of stakeholders, which is really pleasing to see. Sometimes it's the partners that we work with and they use it in an advocacy context to change. Other times it's used to push back on the alcohol industry. A really good example of how some of our research has influenced that was particularly the social and economic cost study, to really emphasise the harms that could be caused by Dan Murphy's coming to Darwin. So whilst we've kept Dan Murphy's at bay in the Northern Territory, specifically in Darwin for the time being, it doesn't mean that they won't show up here eventually. We've got to keep generating that evidence to show what harms alcohol continues to do, particularly to those most vulnerable. The work that I've been able to lead in the Northern Territory has not been mine on its own. It has been fundamentally underpinned by building the capacity of novice or junior researchers to learn and grow, people that are at the beginning of their careers. And in many cases, it's provided a springboard for them to go on to do bigger and better things. The alcohol research that I've been involved with in the Northern Territory has not been possible without collaborating with a whole range of partners. We've had some amazing funders, the Northern Territory Government. We've worked closely with the Northern Territory Primary Health Network, the Alcohol and Other Drug Foundation, and of course there's the collaborations and partners that we work with. I really thank all of those organisations for what they contribute. We can't rest on our laurels, we've got to keep going, we've got to keep producing more research, new evidence, keep things contemporary, to keep ahead of the alcohol industry and to really take action against social and commercial and cultural determinants of health.